Hi everyone, my name is Glenny Perez and today I will be interviewing my mom on muscular dystrophy. The most well-known of muscular dystrophies is Duchenne followed by Becker. Muscular dystrophy is a group of inherited diseases characterized by weakness and wasting away of muscle tissue with or without the breakdown of nerve tissue. Did you know that there are 40 types of neuromuscular diseases, including 9 types of muscular dystrophy, with each type involving an eventual loss of strength, increasing disability and possible deformity? Each type differs in the muscles affected, the age of onset, and its rate of progression. In the article Types of Muscular Dystrophy and Neuromuscular Diseases is a credible source because it dives into other diseases, their effects into each one. The 9 types are Becker congenital, Duchenne distal, Emery diffuse, fascio capillohumeral, limb girdle, myotonic. Just a brief introduction on the topic and issue, and now we will begin the interview. My purpose is to inform others of muscular dystrophy and view the life of a person with it and how they handle it. It will show the struggles, what they have done to live with their disease, and any support along the way that helps them. What is your name?
Edith Gonzalez.
And I want you to tell me more about your story. How did it start?
My story. Well, I don't have that much to say. All I have to say is that I'm born with a muscular dystrophy. It's a disease that you're born with it. The neurologists, all the doctors told me that they don't have a cure for it. They're working on it to find something so muscular dystrophy can be cured, but it takes a long time and we don't know when they're going to find the cure. But since 2018, my muscular dystrophy is increasing.
It all started in December of 2016. She went to work and everything was going well. She got on her lunch break and she bought a strawberry lemonade. She took it out of the refrigerator and started to drink it. 5 minutes later, she felt dizzy and felt lightheaded. She passed out and her co-workers called 911. As they saw her on the floor, she wouldn't wake up. The paramedics had to resuscitate her. During that process, she felt like she was leaving her body and seeing white. She said she asked God to let her stay because she wasn't ready to leave and didn't want to leave her daughter alone. She then came back alive. It turns out that one of her co-workers had put 100 milligrams of marijuana in her drink, from what the doctor told her. And then afterwards, the doctor diagnosed her with palpitations, which is high blood pressure. Then in 2017 to 2018, she would go in and out of the emergency rooms.
Before 2018, I was having headaches, palpitations when I walk, or whenever I do stuff, I feel really tired. The doctors didn't know what I have. They thought that I was having depression and I was having panic attacks and all of that. But finally, one neurology at General Hospital, his name was Dr. Green, he found it out just by looking at me. He's like, there is something wrong with your body. Nothing is wrong with your head, but your body is totally have something. He did an MRI. He did another test in my arms. It's called MLD something. They put needles in your arms.
I searched up the test the neurologist did on her. It is called electromyography, which is a diagnostic procedure to assess the health of the muscles and the nerve cells that control them. EMG results can reveal nerve dysfunction, muscle dysfunction, or problems with nerve to muscle signal transmission. The doctor can detect if there is something wrong in her nerves. He also tested her for many kinds of neuromuscular diseases through using my mother's saliva. To test for muscular dystrophy, it can be a blood sample or a saliva sample. It comes in small kits with instructions for how to test. It gets sent to the laboratory and they detect what types of muscular dystrophy a person can have. The results have to be told by the neurologist.
And he found it out that I have 3 kinds of muscular dystrophy. So I have limb girdle.
Limb girdle, muscular dystrophy is a term for a group of diseases that causes weakness and wasting of the muscles in the arms and legs. The muscles most affected are the closest to the body, specifically the muscles of the shoulders, upper arms, pelvic area, and thighs.
I have the Duchenne.
Duchenne muscular dystrophy is a genetic disorder characterized by progressive muscle degeneration and weakness due to the alterations of a protein called dystrophin that helps the muscle cells intact. The difference between the two would be that one is genetic and the other one is based on the protein the person has, and the other would be feeling sore at points.
And I have another one that I don't know what the name it is, but I have 3. And it's progressing kind of fast.
When she says it's progressing, it means that she can't do the activities she used to do. She can't walk more than a block or she feels like she will fall and have no strength in her legs. This led her to using a wheelchair.
Now, before I was in the point that I can walk a little bit, I can wash dishes. Right now, I can't do nothing anymore. So no more washing dishes, no more doing stuff. It's just been tough this year because I have a appendicitis surgery.
She has had multiple surgeries throughout the years. She had appendicitis surgery this year due to her appendix being inflamed and being at the risk of bursting. She had an emergency surgery on August 30th, 2022. She came home the next day. She struggled to get up from her bed and was screaming in pain after the anesthesia wore off.
Now they just find it out that my my lungs, they're getting smaller. They just find it out that I have asthma. It's due by the muscular dystrophy. Because my lungs are getting smaller, and it's really hard for me to breathe.
The weakening of the diaphragm in people with muscular dystrophy results in reduced oxygen intake and decreased lung function. It is harder to produce air when the lung muscles are lowered by weakness.
So I use 24 hours oxygen therapy. I am a number 2.
She uses 2 liters a day.
Yes, 2 liters a day, 24 hours. And then I need assistance with everything, mostly the assistance when I get up of the bed, when I stand up, when I walk, because I keep falling down from my bed and from everywhere. So it's just like really, really hard disease. It's really sad that they don't have a cure for it.
When people look at my mom, they don't think she needs support. They think that she looks fine and it isn't in need of anything. It is discriminating to her because she is struggling in her disease and she needs to be supported, uplifted in a positive way, not negative. It is related back to ableism, which is when a disabled person is discriminated against by not looking normal. But all my mom needs is extra support. Other than that, she's always happy.
They say that, acting is the best thing. You have to do exercise and walk and do a lot of things. Physical therapy is really good for you, and that's all. It's really a challenge because now I learn how to live around my disease, which is kind of sad because first they take my driver license away. I'm not able to go by myself outside. I need a company. I need somebody to be with me because sometimes I feel dizzy and I cannot drive my chair. And just it's kind of sad because you're not independent anymore. So I was very independent woman. I was driving around, working for IHSS.
In-Home Supportive Services program provides in-home assistance to eligible, aged, blind, and disabled individuals as an alternative to out-of-home care, enables recipients to remain safely in their own homes. Over 555,000 IHSS providers currently serve over 650,000 recipients, And AHSS provider duties are house cleaning, meal preparation, laundry, grocery shopping, personal care services such as bowel and bladder care, bathing, grooming, and paramedical services, accompaniment to medical appointments, and protective supervision for the mentally impaired.
Taking care of my beautiful daughter and drive her to school, and now I don't do that anymore. So all I do is read and listen music, meditations, and all of that. It helps, but it's kind of hard. It's sad. So all people who have this disease it's really hard. But I hope one day, I pray God that they find the cure for muscular dystrophy, and we all patients who have muscular dystrophy, we all be cured. And that's I hope they somebody find a cure for it, like they did for COVID-19. They find a vaccination, and I hope one day it will be like that for muscular dystrophy. They find it out that you're born with that disease, and they say, hey, we have a vaccination for muscular dystrophy to prevent muscle weakness. So it be the dream. So that's my dream, and that's my story to tell everybody. And I hope you guys understand what I say, because my primary language is not English, it's Spanish. So I'm just I'm from Guatemala, and I have 39 years old, and I born in June 25, 1983. I am a happiest person. I have a beautiful daughter, very smart, and she also is diagnosed with the muscular dystrophy.
November 2019, I was diagnosed with muscular dystrophy. I only have one type, which is limb-girdle. I received it from my mom at birth. Ever since then, I have felt my life change dramatically. I get tested yearly to see how much I have progressed and if I need physical therapy. The testing the neurologist does is an echocardiogram, which is a test of the action of the heart using ultrasound waves to produce a visual display used for the diagnosis or monitoring of heart disease. An electrocardiogram, or EKG, records the electrical signal from the heart to check for different heart conditions, and a breathing test. The neurologist told me that for me it would be mainly attacking my heart, as I could have heart problems when I'm older, and they are monitoring me to make sure that I am healthy and well.
And we try to live happy, and we pray God every day, and we have a strain on Him. And I know that all we're going to die, but we have to be happy and kindness in this earth, so that way we make life happy, because we all have ups and downs, and we just have to live with the situation and learn how to be strong and have faith in God. Because if you don't have faith in God, faith is the one thing that you can never lose. There is faith, hope, and love. And you just have to be strong and fight your dreams. And one day you will be open your eyes, and there you go, a vaccine for muscular dystrophy. That's my dream. Thank you, everybody. I hope you listen my story.
I have been researching a lot about this. They say I've seen some stories, but they say that there is like a drug that you can use for like muscular dystrophy. It's like for the heart. It helps the heart like slow down a little bit if you have palpitations. And then there is a few more others that the FDA passed by. That's the Federal Administration drug. They're in charge of like making sure that it's safe for people to take. It was for Becker muscular dystrophy. It would give cardiac support, which improves heart function. In the article, it said that there are two cardiac drugs. The article is Understanding the Research Network Studying Dystrophin Deficient Heart. 2 cardiac drugs, lorcetan and lisinopril, for the effects on the cardiac and skeletal muscle and DMD. 2 drugs to see if they work for those with cardiac problems. It could lead them into having less palpitations and their heart to not grow bigger. The people who decide to participate will have to do an electrocardiogram to check their heart and see if they need it. It would be done through yearly testing to see if the drug worked and to be patient to see it. And it's been on trial since 2012 and they passed it this year, so maybe there might be a possibility that there could be a solution. I haven't really looked at to see if people have a good side effect to that. It doesn't really say much on the website, but I believe that might work.
And how about the medication that your neurology prescribed for you?
He said that it does work, but it makes you very tired, and you have diarrhea as a side effect.
I mean, you never try it, but if you try it,
it's called prostagamine. It's 60 milligrams, and I'm supposed to take it twice a day. It is used to improve muscle strength in patients with a certain muscle disease like muscular dystrophy. It works by preventing the breakdown of a certain natural substance in your body, which is needed for normal muscle function.
but you never get it. So you need to call pharmacy and get it.
My neurologist suggested to take, to do more exercise and to get a personal trainer. But it's super hard because it's hard to manage it with school. So I'm very lazy. So I try to do at least something, walk around, walk up hills when I go to school. Or if I find parking far, then that gives me the opportunity to walk far and to my class and then back. But it's still not enough. I still need to work. But yeah, that is our interview, and we hope that this is enough information and that peer review goes well today. Thank you.